Hello, my name is Shlomo Yedvab, and I'm a patient. The topic of my presenting is living with bile duct cancer. My doctor discovered something hard during a routine annual exam. He did a complete blood workup. At my follow-up appointment, I was told my bilirubin number came back at 10 or 11, and that most likely a sign of cancer. But to confirm this suspicious, he would refer me to a gastro clinic who would get the bottom of it and let me know for sure. During my visit in the gastro clinic, I was diagnosed with bile duct cancer. My diagnosis was grim, so I sought out to find a second or a third opinion to be sure. I even saw out the possibility of surgery. We met with the director of transplant in a major hospital here in Atlanta to see if there was any hope of a transplant. And I was told that because of the location of my tumor, a transplant was not an opinion, is not an option. All three doctors gave me the same prognosis. I would have 3 months to live if I did nothing. And 1 year, I pursued radiation and chemotherapy treatment. Friend of family members direct us to MD Anderson Cancer Center in Houston, Texas. Within days, I had an appointment for an assessment. By the time I reached Houston, my bilirubin had increased to 22 or 23. My gallbladder had ruptured, and I had contracted 2 very dangerous bacteria infections. My first week in the hospital, I had 3 tubes inserted to my stomach. After I was stabilized, I met with the oncologist assigned to me, and he gave me same prognosis as the 3 doctors from Atlanta. One day, my IR doctor came by to check on me, and we chatted a bit. He told me he was part of a team that met each week on Tuesdays, and that he would present my case to see if this team of doctors could offer me a better solution. That team of doctors saved my life. After 3 months stay and receiving treatment, radiation and chemotherapy, we headed home. This tour was an extremely difficult phase because everything was laid out for us in Houston. And we headed home, there were so many unknown, and it was terrified. We were lucky enough to get a referral for an oncologist at Emory St. Joseph Hospital in Atlanta. He and his team have been instrumental in caring for me over the past 2 years. Two of the biggest concern with this disease is having an oncologist who will work with you and properly guide you on this journey, and the other is managing the biliary drain. My oncologist is very familiar with this disease, but everyone else I interacted with in the hospital and through home health care was not at all aware of this disease or how to behave. In my case, I found I had to educate the doctors, the PAs, and the nurses. We worked to build a relationship with IR department staff, physician assistants, and nurses. Each time I was hospitalized, we learned something new about how to take care of the drain. Two critical things to mention is clotting. After the first few weeks of being home, I experienced very large blood clot, but after a time, it seems to pass. A year ago, I went to the hospital for severe bleeding from my biliary drain site and needed to have blood transfusion. This is something that must be closely monitored, and help must be sought out immediately. The drain is a big concern because they are sensitive and they can malfunction at any time. It's critical to note that no one should really 100% on home health services to manage the drain. Home health should be used only as supplement care. Someone in the home needs to be able to take care of the drain daily. Being able to change dressing when needed will prevent infection. The drain will respond to a diet. Healthy diet, less problem. Bad diet, big problems. Today, my treatment includes 1500 milligrams per dose twice a day for 14 days. And my resting period is between 7 to 10 days. Lately, we find out that 10 days to be the magic number to manage the side effect. The main side effect from the chemotherapy treatment is hands and foot syndrome, dry eye, and fatigue. Diet and exercise are very important for me. Diet, because it keeps the liver and tumor in check. And exercise, because it keeps me mobile and feeling good. Thank you for allowing me the opportunity to share my story.